A 44-year-old woman came to the hospital with a newborn baby, saying she had a rush home birth. She categorically refused medical examination. But after much persuasion, she nevertheless agreed. It turned out that the woman didn't have a uterus, therefore, she could not give birth. Whose child was it, and how did she get it? Let's figure it out. 1973 Los Angeles, California, USA. 42-year-old Norma Jean Jackson lived alone after the divorce. The woman had an adult son and daughter, but due to constant disagreements, they stopped communicating. Norma worked as a nurse in the maternity ward of the Kaiser Hospital. Once Norma met Charles Armistead. They became lovers. Charles had a wife and 2 daughters. Despite the fact that they were not in a legal relationship and didn't live together, the woman took the name of Charles and became Norma Jean Armistead. A year later, the relationship of couple almost came to naught. Norma saw that Charles had lost interest in her. She was afraid that he would leave her, so she tried with all her might to keep him. Norma knew that Charles really wanted a son, and believed that the appearance of a child could strengthen their relationship. But she could not have children, but Charles didn't know about it. 13 years ago, Norma underwent a hysterectomy, an operation to remove the uterus. In 1974, after another quarrel, Norma told Charles about her pregnancy and said that she was sure that there would be a boy. Charles was glad. The relationship of the couple gradually began to improve. To support her legend, Norma began to imitate a growing belly, began to wear loose clothes. Not only Charles, but also colleagues at work were sure of her pregnancy. Despite the fact that Norma worked at the Kaiser Hospital, she told everyone that she was registered with another medical institution, which was located in the same area. Months passed, the time was approaching childbirth. Norma hoped that one of the women in labor, who would go to the hospital where she worked, would give up the baby. But this didn't happen. Norma came up with a terrible plan. Charles was dark-skinned, so Norma couldn't bring home a baby with fair skin. She began looking for pregnant dark-skinned women and mulattoes. On September 20th, 26-year-old Mary Childs was admitted to the maternity ward. She was the perfect candidate for a terrible plan, so Norma decided to act. Mary Childs was in early labor, so she was placed in the observation room. Norma remained on duty that night. She behaved with the woman in labor very friendly. Mary never doubted for a second that she was in good hands. In the dead of night, Norma injected Mary with a large dose of a strong sedative drug. She told Mary it would help relieve the pain. Mary felt bad. She lost consciousness, and again came to her senses. Then Norma injected Mary with several doses of a drug that stimulates labor. Almost in an unconscious state, Mary gave birth to a girl and immediately fell asleep. Without wasting a minute, Norma took a stillborn premature baby from the morgue. His weight was 3 pounds, that's about 1 kilogram 300 grams. Norma placed the child between Mary's legs. Picked up a newborn girl, took her home and simulated childbirth in the bathroom. In the early morning, Norma showed the baby to Charles, but he was disappointed to learn that it was a girl, not a boy. On the same day, Norma went to another hospital to register the birth of her daughter, whom she named Carrie. She said she had a rush home birth. The medical staff wondered why Norma didn't go to the hospital where she worked. She replied that there was poor postpartum care. Norma refused to be examined. She claimed that a doctor had examined her in another hospital, everything was fine with her. The story seemed plausible to the doctors, and they completed all the documents. While Norma was busy registering the baby, the morning examination was taking place in the maternity ward of the Kaiser Hospital. Mary Child was found unconscious in the ward with a dead child between her legs. She was horrified when she was brought to her senses. All Mary remembered was that the nurse gave her a sedative injection. Mary's blood test showed the presence of drugs. The doctor said that she was a drug addict, which killed her child a few days before the birth. It was claimed that she gave birth herself and cut the baby's umbilical cord. Mary denied everything. She said that at the time of admission to the hospital, the child moved and the doctor himself heard a heartbeat. In addition, the estimated weight of the child was supposed to be about 8 pounds, that's about 3 kilograms 600 grams, and the dead baby was clearly less. No arguments convinced the medical staff, no one wanted to listen to Mary. The next day she was discharged from the hospital. After lunch, Norma called the maternity ward where she worked and said that she had given birth to a daughter, when she came home from duty and was in another hospital. When the doctor asked her about Mary, she replied that she really had taken a sedative injection and didn't go into the girl's room anymore. She also added that she went home a little earlier, because she felt bad. Relationship of Norma and Charles again cracked. The appearance of a daughter could not strengthen their union. Norma was convinced that if a son appeared in their family, then Charles would definitely not leave her. So she started faking pregnancy again. Only this time, Norma didn't have access to the maternity ward to pull off her terrible plan again, as she was on maternity leave. She made up her mind to do something worse. After 8 months, Norma became friends with 26-year-old Catherine Viramontes, who was 9 months pregnant. Their acquaintance happened near the hospital and it was not accidental. Norma specifically tracked down pregnant women with dark skin, started a conversation and found out what gender the child would be. May 16, 1975. Norma was visiting Catherine. Apart from them, there was no one else in the house. The girl's pregnancy lasted a week longer than expected, so Norma persuaded her to take an injection that was supposed to stimulate labor. Catherine trusted Norma, because she knew she was a qualified nurse. Catherine had no idea that Norma would inject her with an anesthetic injection that would paralyze her muscles. After Norma immobilized Catherine, she sealed her mouth with duct tape, stabbed her in the throat, then performed a cesarean section, and removed the baby. It was a boy. Catherine died quickly from blood loss. Norma wrapped the baby up and sent her to the nearest hospital, where no one knew her. Doctors might have questions, because just 8 months ago she allegedly already gave birth. In the hospital, Norma again repeated the familiar story of a rapid home birth. She refused to be examined, and said that she simply wanted to register the birth of her son. The baby had a fever, so he was taken away for examination, and Norma was admitted to the postpartum ward. On the same day, Catherine's bloodied body was found by her husband. He immediately contacted the police. The detectives decided to check the maternity hospitals first. They started calling hospitals, and it turned out that a woman with a newborn baby had recently come to the nearest one, acting suspiciously. The police went to the address and questioned Norma, then called a gynecologist and insisted on an examination. It turned out that a woman cannot have children, because she has no uterus, and by all indications the operation was carried out a long time ago. After conducting an investigation, the police found out that 8 months ago, Norma registered the birth of her daughter, who, in principle, could not give birth. Detectives went to her home, where they found 8-month-old Carrie. After conducting a DNA examination, it turned out that the girl is the daughter of Mary Childs. She sued the hospital and was awarded $375,000 in compensation. Mary has come a long way to get her daughter back. During the trial, Norma said that she was convinced that Catherine was Charles's mistress and that the child was his. Norma came to talk to Catherine, but an argument broke out. Norma, in the heat of passion, stabbed Catherine in the throat. Seeing that the girl had lost consciousness, Norma was afraid for the life of the child, so she performed an emergency cesarean section to save him. Norma Jean was diagnosed with borderline personality disorder but was sane, so she was sentenced to 75 years at the Women's Correctional Center in Chowchilla, California. The last years of her life, Norma had big health problems. She suffered a stroke, suffered from heart and lung disease, arthritis, diabetes, and she also had blood incoagulability. In 2015, the woman was released on parole and sent to a rehabilitation center, where she died the same year. Doctors were unable to stop the bleeding, which was formed due to bed sores. At the time of her death, Norma was 84 years old.